Today, we will look at a sample visit. Because this is a demonstration, our visit will be shorter than a usual visit. Telehealth visits are blocked off for 30-minute sessions with virtual therapy partners. So once you have scheduled an appointment, you will receive email reminders to log in at the time you had scheduled. When you log in, you will see a notification that the therapist has started the appointment, no different than you would see when you get a phone call. Click to accept to begin the call. Hello, Allie. Welcome to our first virtual visit.
Hello, thanks for doing this with me. I really wanted to talk to you about my shoulder.
All right, well, tell me about your shoulder.
I hurt my right shoulder while I was playing golf the other day. I was driving probably around the 12th hole and I felt a really bad pull. I did finish up playing, but I woke up today with just this pretty severe pain.
Okay, I'm sorry about that. What level is that pain? 0 pain is no pain, and 10 pain is the highest.
Today's probably about a 5. I think with any kind of sharp movement or swinging it further, it jumps up from there to probably about a 7.
Okay, and can you point to the spot of your pain?
Sure. It's like right here.
Okay. All right, understood. Have you had any numbness or tingling down the arm?
No, not really.
Okay, how about any neck pain?
A little bit. I do feel kind of like a little bit of a spasm right here, especially when I move it.
Okay. Well, I'm sorry to hear that you're having that pain, but now what I'm going to do is I'm going to ask you to do a few things for me movement-wise so that I can help pinpoint where your pain is at. Obviously, I want to make sure that, you let me know where you feel pain and when there's no pain, because as we're doing this movement analysis, I want to make sure that I can accurately depict where your pain's at to devise the best first couple exercises for you today.
Okay.
What I first want you to do, everything you're going to do is with your right arm. So I'll demonstrate with my left arm, since it's the video, to mirror back to you. Okay? So what you're going to do first is you're just going to raise your arm right up over your head like this. Any pain there?
No pain.
Okay. Bring it down slowly. And now you're going to come out to your side and all the way up and over.
Yes, I have a little
Little
pain.
pain. I saw that slow down right at the end there. So
Yes.
yeah. And that's to be expected from what I'm seeing, what you were telling me. So now what I want you to do is I want you to lock your elbow at your side, and I'm going to adjust my camera so that you can see here for me. Lock your elbow in at your side.
Mm-hmm.
And I want you to bring your shoulder out. Right?
Mm-hmm.
Bring your fist back in towards your stomach.
Mm-hmm.
Now, was there pain going out?
Yes.
And how about when you brought it back in?
A little bit.
Okay. Now, what we're going to do is a couple motions at your neck, all right, to help see if you're having any pain there. So, especially when we're moving in the opposite direction, when you're moving to the left, I want to let me know if you're feeling pain on that right side, okay?
Mm-hmm.
So first, just looking up and down for me. Any pain there?
No pain.
Okay. And now I want you to rotate your head right and left. Slow it down just a bit.
Pain when I go to the left a little bit.
Okay. And it's on that right side.
Mm-hmm.
And can you point to that? Is it like right in this area here?
Right here, yeah.
Okay. All right. Now what I want you to do is I want you to bring your ear towards your shoulder. Back to the other side.
Similar spot of pain when I go to the left.
Okay. All right. So when I'm watching you move, from what I'm seeing, it's likely that you just strained your shoulder during a follow-through on one of those drives that you were doing on the golf course. So oftentimes, when we are just getting back to playing sports, our muscles aren't quite ready to take on the full force of the sport, but also the demand of the duration of the sport. So golf is obviously a very long duration of time, and multiple swings, repetitive movements can put a lot of strain on your muscles. Now, in a follow-through, and I'm assuming you're right-handed, in a follow-through as you're coming through, as you're decelerating your motion, there's a lot of force going through your muscles in your shoulder to slow that swing down as you do your follow through. And so when you do that, it puts a lot of demand on your muscle and can cause some strain. Now, when you have a shoulder injury, usually you'll find some spasming in the neck as well. And so that's why I was asking about, the tightness in your neck. I just wanted to make sure that we didn't miss anything there. So oftentimes if you're turning to the left or you're bending your neck to the left, this muscle on the right side is going to be very stretched out. So if it's in spasm from what's going on with your golf swing, you're going to have some pain there as well. So if you think about your golf swing, you're following through, you're moving your head. So we want to make sure we improve all that range of motion. So what I'm going to do is start you off with 3 stretches that I want you to do for the next 3 days. And then we'll hop on another telehealth call in a few days, follow up, and progress your exercises to some strengthening activities from there.
Okay, sounds great. Thank you.
All right. So we're just going to do 1 repetition of each, okay? And what we'll do is I'll do a stretch. We'll do like a 10-second hold for it. But when I send you these exercises, it's going to say to do a 30-second hold. But I just want to demonstrate the proper technique here. All right, so the first one you're going to do, so we're dealing with your left side, okay? Or your right side, I'm sorry. And so I'm going to demonstrate in the opposite direction so that it mirrors you on the video screen here. So what you're going to do is you're going to bring your arm up over your head and grab the opposite side, and you're going to pull your head towards your shoulder. Now I want your head rotated so your chin is pointing slightly down. There you go. And just hold it there. Now do you feel that stretch right along the outside of your neck down to your shoulder there?
Yes.
Okay, so you're going to be holding that for 30 seconds when you do this, so you're going to do it 5 times, okay? So you can return here. Now the next one is when you follow through with your golf swing, you put a lot of strain through here. So that muscle back there is probably a little bit of a spasm. And of course, because this is a video conference, I cannot, be able to palpate and feel that muscle, but I'm assuming it's a little tense right now. So what we're going to do is we're going to stretch that out. So you're going to bring your arm across your chest. We'll go this way for the purposes of the video, and we'll pull across. Very good. And you're going to hold that for a little bit of time there. And what we're going to do next is, after you do that for 30-second hold 5 times, you're going to do another stretch. And this is going to actually stretch out a muscle in the back of your arm. It's your triceps muscle, but it actually does attach up in your shoulder. So oftentimes when you're doing that follow through, it can get pretty stretched out and overused. So what you're going to do here is you're going to bring your arm over your head, no different than what you did before, but you're going to tuck that hand behind your back. You're going to reach over with your left arm, and you're going to pull that arm down. You should feel that right in the back of your arm there. You feel that?
Mm-hmm.
Okay. So I'll send you all these exercises through the patient portal so that you can review. Be sure to check off in the system when you do them so that I can track how you're doing. We also have that patient portal where you can upload your pain level and how everything is feeling so that I can analyze in real time and then be able to devise a effective progression of your exercises for our next visit. So if you have any questions, you can message me in the system, and we'll just talk in a few days.
Okay, thank you so much, Dr. Frick.
All right. Take care.